Back pain is one of the most overdiagnosed and overtreated conditions in medicine. And a big reason is this: we've confused technology with truth. The story I'm about to tell you shows how powerful tools like X-ray, MRI, and even AI can mislead us and fool us into treating problems that may not even really exist. John was 42 when his back gave out at work. He bent down to tie his shoe, felt a sudden stabbing pain in his back, and fell to the floor. He was whisked off to the ER, where the doctor took one quick look at him, saw the pain that he was in, and immediately ordered an MRI scan. And there it was, a bulging disc. And everybody assumed that was the answer. He was sent to a surgeon the next day. The surgeon took a quick look at the MRI and said, there's the problem, and we can fix it. A couple of weeks later, and a few phone calls to the insurance company, and John was on the operating table getting repaired. The bulging disc came out, everybody was happy with the result, and when John woke up, he was still in pain. And over several weeks, his pain continued to get worse. Why do you suppose John got worse? Well, probably because the disc wasn't the problem in the first place. MRI scans will show abnormal discs in more than half people over 40, even in those who have never had a single day of back pain in their lives. John's pain wasn't from his disc at all. It was from another structure in his back called a facet joint. But the MRI doesn't read facet joints well, or doesn't identify problems in facet joints well, so that was overlooked. The thing that looked guilty on the MRI was the disc, but it was really just a bystander. And this isn't the first time we've been fooled by a tool. In the early days of X-ray, when doctors first started using it to peer inside the human body, they noticed that when they took X-rays of somebody's abdomen, the organs were in the wrong places. The liver was too low, the stomach was too low, the intestines were all out of position. Why did they think this? Because up until the advent of X-ray, the only way anybody got to look inside the human abdomen was during surgery, and the position of the patient during surgery was lying flat on their back. The organs weren't affected by gravity in the same way they were when the patient stood up. So everything was out of place on X-ray simply because of gravity, not because there was any particular problem. But guess who got the X-rays? Patients with belly pain. And when the X-rays showed that the organs were out of place, well, obviously that was the problem, and surgeons even developed an operation to tack all the organs back into the right position. Again, a tool gave us the wrong diagnosis. These tools dazzle us with what they can see. They show us a new way of looking at the human body or the human condition. Whether it's X-ray or MRI or even AI, the risks are all the same. The tool looks at the problem and says, aha, there it is. That's what needs to be corrected. Instead of being able to identify all the variations of normal, we classify everything we see that doesn't look like a textbook answer as abnormal. And in this way, we start to pathologize the normal human condition. We turn sadness, worry, or anatomical imperfection into disease. The moral of this story is, tools don't create the meaning, people do. If we let the tools define the truth without context, we will always be misled. John's MRI was wrong. The first X-rays were wrong. And unless we learn this lesson, we're going to be in for a whole lot of trouble with AI. If you've ever been told your MRI explains everything, you should think twice. Pictures don't make the patient. There's much more to the story of your pain than just what the MRI tells us. Your history, your physical exam, the timing and development of your pain tell us far more than any image or AI ever could. That's why I built Pain Optics. Put the focus back on your story rather than on technology. I'll put a link down below where you can try it and find out what your pain really means.